care from menstruation to menopause and beyond. And so our team helps ensure that folks have access to abortion, that they have Plan B kits, condoms, that they have aftercare kits stocked in clinics that we partner with. We create beautiful, creative zines with and for our community. And we work to try to realize the ideals of reproductive justice in our lifetime. And we know that to really have that as the lived experience takes community. And it's also going to take dynamic, capable leaders and storytellers. And so we also have a reproductive justice fellowship, storytelling among our callers, and a peer support group among our callers. And so if that sounds exciting, that is just a fraction of what we have cooking up. And so I invite you to follow us at arc_Southeast on Instagram. I'm sure lots of you are already doing that, but follow us. Make sure that you are signed up for our newsletter. We have volunteering that is also relaunching the Monarch, so you can join and be a Monarch. You can also become a donor. So we love solidarity in spaces such as this space that we are sharing here tonight. We also love solidarity in helping us fund all the initiatives that we have to ensure that Southerners get the care that they deserve. So we invite you to really step in and be a part of the ARC Southeast family. And so, Black August is not just about studying, it is also about actively resisting, working in solidarity with others. And that is one of our guiding principles. We're excited tonight to hear from an amazing panel to speak about joining in collective struggle. And so, think about the ways that you can help make the world a more beautiful and better place. And we'll be hearing firsthand from folks that are doing just that. And so, thank you for spending your Friday with us and helping us to celebrate Black August. And I will pass the mic to Musa.
Thank you for that, Angel. And it's always wonderful to hear Asada Shakur's words and to uplift Asada as much as we can. I think sometimes people might forget that she really embodies the essence of what it means to believe in bodily autonomy and self determination. And so, with that, I'm actually going to give us a brief overview into what actually is Black August and why we commemorate Black August. And so, as I said earlier, Zoom is against us today for some reason. So there was an exercise I was going to have you all do in the chat where you just tell me if you've heard of Black August before or before this year in this August. So maybe you all can type it in the Q&A section since our chat is not working and just say yes or no if you have heard of Black August or if it's something that's kind of recent for you to learn about. So right off the bat, I think it's important to state that Black August is not Black History Month and Black August is not Juneteenth. There's a difference between celebration and commemoration. And so in our community, we have days that we commemorate, days that we celebrate, days that we remember in a few different ways. And so Black August is a commemoration specifically of the revolutionary freedom fighters in Black history, both here in the US and throughout the African diaspora, with a special focus on political prisoners and our incarcerated freedom fighters. I want to draw your attention to this artwork in the bottom right corner. The artwork is actually by Kevin Rashid Johnson, who himself is a current political prisoner. And if you look up Kevin Rashid Johnson, he has lots of really, really amazing artwork that he does um, that focuses on sort of depicting and highlighting some of our ancestors and people from this legacy. So, Black August was founded by incarcerated activists in the California prison system during the 70s. This was during a time in which incarcerated people were organizing. They were forming groups to study, groups to sort of advocate for themselves, and they were connecting their struggles inside the prison systems with the struggles for Black liberation that were taking place outside in the streets. One of the most notable figures for Black August is Comrade George Jackson. George Jackson is the author of two books, Soledad Brothers and Blood in My Eye. He was a Black Panther Party member inside of the prison system, and he actually organized entire groups of incarcerated people together. There are four main principles of Black August: study, fast, train, and fight. Study means that we dedicate ourselves to learning about our history, to learning about the radical, revolutionary, and freedom fighting history, to really learn that Black people have resisted a number of ways throughout history, and our resistance has never just looked one way. Fast means that for some people, it is fasting from food from sunup till sundown, similar to Ramadan. For others, it's about naming and creating a different sacrifice for yourself. Some individuals might fast from sweets and sugars for the whole month of August. Others may fast from social media and the internet, which, shout out to them. But the idea is that we sacrifice something of ourselves um, to remind us how important and vital that thing is. And then training. This means that we are training our body to our capabilities, to our abilities. So, physical training in the form of exercise. If you are unable, there's various ways to train. There's a multitude of different ways to train oneself physically as well as mentally. And then, of course, fight within your own capacity. We don't just study the history to know the history, but we study it to actually launch us forward into the future and to determine how we fight going forward. And so, whether that is a teach in, like we're here now, a protest, a study group, documentary screening, or anything at all in between, Black August, as Angel said, is a time for us to resist and to fight and to sort of be current and active. Um, the next slide. Actually, before I go to the next slide, I see five of y'all have said, one person said they had not heard of Black August before this year. One individual has heard of Black August with three exclamation points, period. This is someone's first Black August. Welcome. And then someone else said, of course, they heard about it for the first time this year. So I always like to open with that question because Black August is actually practiced internationally, um, but it is not the most mainstream commemoration or month of celebration and commemoration, particularly because it does focus on freedom fighters who resisted. So I wanted to just run down real quick a few important dates. Black August is significant for many, many reasons. And in the sort of Black liberation movement, we call August a revolutionary month. And these are just a few of the highlights from the history of August that I pulled out. But honestly, it could have went on for five more slides. Um, in 1619, some of the first Africans were actually brought here to the US. August 14th was the Bois Caimon voodoo ceremony, which would later spark the Haitian Revolution. Of course, on August 22nd, 1719, the Haitian Revolution begins. You can go on our Instagram and scroll, and we actually did a two-part post all about the Haitian Revolution and how it relates to bodily autonomy and reproductive justice. And then there are a number of really infamous uprisings of the enslaved Africans, such as Nat Turner's Rebellion, Gabriel Prosser's Rebellion, and so forth. There's also the General Slave Strike that took place in 1843. We have the sort of what we know as the formal beginning of the Underground Railroad, August 2nd, the Fugitive Slave Law Convention on the 21st, and then several other just notable moments. As it relates to Black August, especially with the focus on political prisoners in prison, we look at the infamous Watts uprisings, the Attica prison uprisings. And notice that I'm saying uprisings. A lot of times people refer to them as rebellions or riots. But that is, and in the abortion world, we talk so much about the importance of language. And it's really important that we call these uprisings because these were Black people intentionally rising up against sort of oppressive systems. And so, what were they rebelling against? Right? They were uprising, they were fighting for their liberation. And then there's the assassination of George Jackson on August 24th, which was the anniversary was just 2 days ago. Um, Lastly, on August 8th, there's the infamous Move bombing, which takes place. And so these are just a few of the reasons why August is so important. And if you do some Google searches, which we all know how to do, um, there's been a lot written that goes way deeper into detail about Black August. But really, the idea is that we're centering resisting, we're centering our family members, our siblings, our friends and comrades who are inside the prison system, um, and really thinking about what it means to desire bodily autonomy in a country in which there's a mass incarceration of our people. And so um, I think one other person in the chat said, "My first Black August, and I'm ready to study, fast, train, and fight." I love to hear that because that's what we're here to do today. We're going to do some studying and learning, and we're going to learn from some medical professionals about how they are resisting sort of within their own capacity. So, without further ado, I am going to pass it over. Or actually, before I pass it over, my bad. I want to ask us again. I know that ignore the chat situation, but drop it in the Q&A section, and I want us to just take a moment to center ourselves and to honor the names of some ancestors and freedom fighters who inspire you. And I want you to type those names in the Q&A section for me, because there's power in when we read these names aloud and we bring them to life and we bring them into the space with us. So I'll give you maybe 30-ish seconds to think of some freedom fighters, some ancestors who inspire you, and then drop them into the Q&A section. All right, starting off strong. I see June Jordan. We want to honor Sister June Jordan. Fred Hampton. I could be wrong, but I believe the anniversary of Fred Hampton's assassination just passed, if I'm not mistaken. Someone said Ruth Gilmore and Fred Moten. Nat and Marcia. Nat Turner, Ida B. Wells, Wangari Maathai, Marsha P. Johnson, Safia Bukhari. If you all have never read Safia Bukhari's book, it's called The War Before, and it's her firsthand account of being a political prisoner and as well as being a Black Panther. Safia Bukhari, The War Before, is one of my all-time favorite books. Someone said Assata Shakur, who was already mentioned, repro rights as a whole and the question of birthing life into a deeply unjust world. One of my favorite Assata quotes, quote, "I am all about life. I will not kill my children in my head before they are even born." That's powerful. And if y'all have never read the autobiography of Assata Shakur, it's a great place to start for your Black August study. And it's also available on audiobook. All right. So thank you all for bringing in some of our ancestors into this space. Throughout the talk, if there's any ancestors or freedom fighters that come to your mind as the panelists are talking, feel free to drop them in the Q&A. We will have a Q&A section at the end of the panel. So please, any questions for the panelists that come up, feel free to drop them as well into the Q&A section. So now I'm going to pass it over to our hostess with the mostest, my good sis, my good Judy, Miss Brittany, and I will peace out.
Hey y'all, my name is Brittany Louise. I am the Organizing and Outreach Manager here at ARC Southeast, and I am so excited to be here with y'all. It's going to be a great time. We have some great questions. We have some phenomenal, amazing panelists who are getting ready to introduce themselves. Before we hop in, I just want to reiterate something that I think both Angel and Musa said, which is that like we want you to uh, have what you need in this space, and we want to make this space as accessible as possible for folks. With that said, please feel free to use the Q&A, all to voice any thoughts or feelings that you're having, and also like if you have any um, access concerns, if you need us to slow down, if you need us to repeat something, definitely please use the Q&A to name that, and we'll do our best to respond as it's happening. Okay. So without further ado, I will pass. We're gonna get started. So I want to start off with some introductions of our panelists. So I would love to hear from y'all, your name, your pronouns, where you're located, and a little about your organizing and your role inside of Repro. Let's start with Leila.
All right. Greetings, revolutionary greetings to everyone. I'm Leila, Leila Abadir. I don't know if my last name is on here. I use she, they pronouns. I'm located in Atlanta, and I am a midwife. As far as like my role in community organizing, I'm a member, as well as some others on this call, of the Black Alliance for Peace, here in Atlanta and nationally, as well as a smaller like African diasporic collective called Ukombozi Atlanta, Africa to Atlanta, that focuses on trying to get like recently immigrated African folks around each other to both socialize, but also talk about like current events and doing political education around what's happening on the continent of Africa specifically. And then just do like things with the Black Alliance for Peace around like coalition work for Palestine, as well as like Cup City stuff, when that pops up. And again, I'm a midwife, so I try and blend all the things all the time.
Period. Thank you so much, Leila. We'll pass it to Paris. Dr. Paris.
Dr. Paris. Hi, everyone. I'm Paris McAllister. Greetings, greetings. So just thank you all for allowing me to be on the panel. I'm just honored because I've known both Claire, Leila, and Musa for a while. So I'm really excited about this and getting the opportunity. I use she, they pronouns. I'm based in Atlanta. A little bit about myself. I'm an OBGYN here in Atlanta. I've been organizing in organizing space for about 10 years, specifically in Atlanta, with different organizations that focus on reproductive justice, anti-imperialism, and healthcare access. I'm a member of Doctors Against Genocide and Healthcare Workers for Palestine. More in the medical field, I do research and publish in work that has to do with healthcare access. I'm specifically dealing with food disparities, food deserts, also in my term, food apartheid and how that affects Black folks. I've been involved in reproductive justice since 2019, specifically where the heartbeat bill was passed here in Georgia and introduced. So now I've been practicing for over a year here in private practice, but it also deals a lot with folks and has sliding fee scales and things like that who need proper access. And hopefully in the future, Musa and I are trying to collaborate to possibly bridge the gap between providers and reproductive justice organizations and essentials and necessities for that. Oh, one more thing. I was in Florida for 4 years for residency. This is important because that's why I went to Florida and back here. So we'll be talking a little bit about Florida laws and things as well.
Gonna get juicy. We already know Florida. Florida. All right, Claire, last but not least, let's hear it.
Hey everyone, thank you guys for joining tonight. I'm super excited for our discussion. I'm Claire. I use she, her pronouns. I live on occupied Lenape land, otherwise known as New York City. I'm a combined internal medicine and pediatrics specialist. So, and I'm completing my fourth and final year of residency. Um, yeah, snaps to that, seriously. Um, but yeah, I guess being an adult medicine and pediatric provider, I think sometimes we think about reproductive justice as just like the right to an abortion, or people working in repro as just like OBGYNs or midwives. But thinking about like the root word reproductive, I think about reproductive justice as like, how do we reproduce ourselves as human beings? What are the things we need to like reproduce our lives? Like safe housing, clean water, access to food, education, healthcare, all those types of things. And yeah, I think in my role working with children and with caregivers and parents, um, like this, I kind of encounter reproductive justice just in the ways that I see them, there being barriers to people being able to like live their lives in dignified ways. And so I think in terms of, like, organizing, I have tried to, like, organize within the workplace to build collective power amongst, like, healthcare workers, but also outside of the workplace. I'm also involved in the Black Lions for Peace. I'm, heavily involved in Healthcare Workers for Palestine. We're seeing, like, billions of our taxpayer dollars go to funding war and, killing children, um, instead of funding healthcare in America. So I think that's why it's really important for us to, like, make those connections and see how, um, yeah, our experience with healthcare is also tied to, like, the ways that we're funding, like, war and militarism abroad.
Okay. Very robust. I appreciate y'all. Thank you for introducing yourselves. And again, if anybody has any questions about anything that they just said, feel free to put it in the Q&A and we'll make sure to see if we can get some of those answered for you. I have a question. I want to start with Dr. Paris. How have you observed racial dynamics play out in your work? Are there any trends or experiences that stand out to you? And this is for everybody, but I want to start with Dr. Paris and then, yeah.
Yes. So this question can be its own channel. It can go on for years. And anyone that knows me kind of understands, kind of people who have been in the healthcare, they'll understand. So it's kind of a two-tiered question. The first being racial dynamics as me as an individual, a Black health provider, and the space that has been very unsafe for a Black healthcare provider, and kind of what that has done for me. Kind of a little bit more about my background. I went to Morehouse School of Medicine for medical school. We primarily practice out of Grady. So it is a lot different than a lot of places where they don't see a lot of predominantly Black physicians, Black spaces kind of around them. But that doesn't still mean that there aren't a lot of kind of racial disparities. It's kind of treated less than because you're Black. The microaggressions, the aggression, admin not leaving you, when you're saying things, when you need things, kind of not respecting your spaces. There's a lot of times when it's, especially in residency, where there's a lot of hierarchy. And I know a lot of people who aren't in medicine, they kind of know a little bit about that, based on different shows and things like that. Like if you've seen Grey's Anatomy, they're living at the hospital like we are, right? But it's not, we're underpaid, we're overworked. Black people are put in positions and spaces that they feel unsafe in. A lot, you're deemed as like the angry Black person, if you're speaking up, if you're doing too much. And they kind of put above you that, hey, if you don't complete that, all of your work is for nothing, right? It's like a sunk cost. If you do something wrong, do something out of line, we're going to take away all of it. So shut up, kind of do what you have to do. So of course, me being a provider who understands what healthcare for what it is, which is capitalist, imperialist system, right? That profits off of bodies that are sicker minorities, that cares about money, status, race, and understanding that, I kind of want to gear more towards the second tier, which I feel very passionate about, is the discrimination and the violence among patients who are Black. I know we have a lot of different attendees here, people who may have been more involved or less involved. So just I kind of want to just go over stats in the beginning. One of the most publicized and biggest stats is the Black maternal mortality rate. Black birthing people are at 3 to 4 times more likely of dying. And people spit around that stat like it's just a number, it's just something that you're saying, but people are dying just giving birth. And we are in one of the said like most advanced healthcare systems, right? And white people aren't dying when they're giving birth in the same type of level. And this confounds for everything. It confounds for people, age, racial, age, marital status, how many babies they have before, how much they make, financial status, confounding for all of those principles. Black people are still 3 to 4 times more likely. In Black infant mortality rate is higher. Black drug testing and drug testing in patients are higher. The increased risk of stillbirth, preterm labor, it's higher in Black patients. Black patients are less likely to get proper responses and to be taken seriously for pain. And all of those things are studied and they're in these societies. So every type of specialty has a society. Specifically, OBGYN had ACOG, which is the American College of Obstetrics and Gynecology. It's kind of our Bible. It's what you go to, right? And it's in there. And they're like, well, we actually don't know why this is happening. So we're saying it's racism. They literally have it. They're like racism, the stress from racism, right? So be nicer to your patient. And we're not going to check on you if you're nicer to your patients. Oh, they're still dying even though we said that, right? And the list goes on and on. So specifically, provider, there's so many different kind of situations that I've been in and things that I have witnessed, white colleagues coming to me in residency saying, we had a Black patient and they like to monitor patients sometimes with the heart, it's called, heart monitors. You like to monitor it. And this patient was saying like, hey, I'm going to walk around my own and I don't want to be monitored. And the nurses, predominantly white nurses at that time, they were saying to my white colleague, like, oh, she's just another one of those Black patients, that thing, we're going to, like, she's being combative, like, we're going to report her, right? And so this is kind of what you see. And so at that time, so she tells me, my colleague, she tells me, and at that time, it's like Sunday, so I have to, I'm like, okay, I'm stepping in as a physician, you can step in, you can have certain, there is certain what it breaks, right? So I'm like, don't touch her, you call me, and tell the patient, you call me, you need anything, you call me. And she very much experienced that. And, if we go on to saying like, okay, these people need to be reported, right? Like report these people that are doing this, report this discrimination. We have to circle back to what healthcare system really is. And it's a capitalist, imperialist society that focuses on money, focuses on class, specifically in the United States is what I'm talking about. So doing those things, these patients were, nurses were reported, but nothing, it's not any dirt off their back, right? I've had one of the most significant things that I went through when I was in residency, was a Black patient who gave birth. She was having a C-section and she started saying that she can't breathe. And I was a lower level, like first starting out at this time. And I'm like, hey, she's saying she can't breathe, right? Anesthesia's just like, da 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 da, like not really listening to her. And then I don't hear her. And then I'm like, hey, what happened to the patient? Could you kind of look over and see like, hey, is she okay? And they're like, oh, she's not talking anymore. I don't know. She's acting weird. What was her drug test? That's what they said. And I said, excuse me? And they said, I was like, what is her blood pressure? Also, I'm in first year, so it's very rate. So I'm talking, I'm telling them, and they're operating. And I'm like, what was her what's her blood pressure? And they were like, oh, it seems like the blood pressure cuff is broken, right? We're in the operating. And I'm like, what? Does she have a pulse? Does she have a pulse? And then I'm like yelling. I'm like, whatever, whatever. I don't care about rank, like what's going on, right? And the head of the anesthesiology department, he comes in and he's like, this patient's in PAC, which is cardiac arrest, like pulseless electrodes, has no pulse. She needs to stop compression. And I had to do compressions on her in operating, right? And that shook me to my core. Afterwards, we have peer reviews where we talk about kind of what goes on. And it's very much like, everyone kind of did a good job. I'm like, no. This is why Black birthing folks are dying. Like, this is the reason. You guys want to figure out the reason so bad? This is the reason. And we see it all the time. You're not listening. You're not acting, and you're putting your own, you literally put a bias in. You literally said, what is her drug test? Right? Like, she did this to herself. And, she wound up doing fine and everything, but we did do that. People were reported. It is what it is, So understanding that, knowing that it's not something that I feel like should, as healthcare providers within the system, I don't get to be like, this is sad and this is bad. I'm like, absolutely, I'm in this system, right? I'm in this system that's doing all of these things, right? And I'm not a distant from it. I'm in it. So what am I going to do? What work am I going to do to try to stop? I'll let someone else talk too.
It's very validating hearing that from you, Paris, because I think that's been a very similar experience for me as a Black healthcare worker within a racist capitalist healthcare system. Constantly feeling like my patients are getting second class care, especially my Black and brown patients, feeling like they're getting second class care. They're being criminalized, surveilled, always like people assuming the worst in them. And then being like the angry Black woman who has to speak up about this amongst predominantly white coworkers. Yeah, there's just like some really harmful stuff that I think we've witnessed, and we are a part of it. But I guess the question is like, how do we kind of mitigate that harm and push back against the evil things happening to our patients at the hands of the system? And yeah, I think kind of to answer the question about how we observe like racial dynamics playing out at work, um, it goes without saying that the entire history of healthcare in America is based on like medical racism, racist exclusion. And when it comes to my experiences in residency, I work at a hospital that quite literally is located on the border of one of the richest neighborhoods in New York and one of the poorest neighborhoods in New York. So many of my patients, or I would say kind of like half of my patients, are poor Black and brown working class people. The other half are like wealthy white people. Um, so the best way I would describe like how we deliver healthcare, our hospital, it's segregated. I see who can get appointments in certain clinics based on their insurance, which is basically just a proxy for like income, who can afford certain medications. It's not the Black and brown folks who has access to certain services like mental health care, substance use treatment. Um, and basically, yeah, how there's kind of like a two-tiered system. Um, and then on top of that, as Paris was kind of talking about, it's how Black and brown folks are viewed by the healthcare system and how they're treated. I think there's a lot of like suspicion and criminalization of Black and brown patients. Healthcare workers also assign a lot of blame to patients, saying like they're not taking their medications, they're responsible for their bad health outcomes, rather than assigning blame to a system that, like, for all of us, even us as healthcare workers, like, how hard is it for you to take care of your health in a system like this when you're working 80-hour weeks, when you are stretched thin with income, especially if you're taking care of children? Like, it's not easy for anyone to live their best life under capitalism. So yeah, instead of assigning blame to like patients as individuals who are literally working up against some of the worst circumstances, like let's assign some blame to the system itself. Um, and it feels as though Black and brown people have everything set up to like ensure their failure, essentially, with regard to like getting good health. Um, So yeah, I think from my perspective, that's some of the ways I see like racism kind of playing out in my work. And I have so many other anecdotes. Like I just don't want to, like, as Farrah said, this could be, that alone is like its own webinar, but that's just like some of my perspective.
I'm gonna do my best to not repeat anything that either Claire or Paris has said. But yeah, so also a healthcare worker, but I'm not a physician. I'm a midwife, which looks very different. But the entire history of midwifery in the US is a racist history. So like even the fact that I am a certified nurse midwife is because of like the criminalization and of Black granny midwives throughout the US South, but like the US overall, where like in the 19th century, almost all births were attended by midwives, like a vast majority were attended by midwives. And that meant that you had someone in your community that knew your family, that spoke your language, um, and provided you not only prenatal care, but oftentimes like you have a cold, you go to the local midwife. And due to like the increase of like education and the growing population of physicians, and OBs in particular, like needed a population to serve to like kind of validate and like validate their position, they pushed out all Black midwives. And we now in 2024 see that like 80% of midwives are white, which speaks also to like the type of care that folks are going to get, but it also like is represented in the type of education that midwives are getting. So there's different types of like, there's different levels of legality and licensure for different midwife types across the state or across the state. With certified nurse midwives being the ones that are generally licensed in all 50 states, but have like a very, very medicalized education system that then kind of has wiped away all traditional knowledge that we had of birth, labor, postpartum, all of that. So like as someone who went into this just wanting to be like a traditional midwife, but realizing like all of the barriers to that, I now have graduated and working, but like have to relearn all of these things again, because that is not a part of the medical model. Um, and that means that people are literally not getting the care they want. Like they're going out of their way to find midwives and are still not getting midwifery care, unfortunately, by and large, at least. That also like shows up in how places like a birth center are actually getting reimbursed. If you don't have a physician on site, insurance companies will literally not reimburse you the same rates, even if you're providing the same care, which means salaries, all types of like supplies for birth centers and all different places that have midwives and not physicians on staff are affected by this. But like it literally trickles down to like actual resources and care for people. Other ways that like that racism shows up is again, so someone who works in a birth center and a hospital kind of, but when I'm at the birth center and we have people that actually like it's appropriate for them to go to the hospital for whatever like medical reason, we now have people that are too scared to go because they know these rates of they know the rates of maternal mortality, um and even when it is now appropriate for them, we cannot get them to like willingly go to that setting. And then they have that experience kind of like reinforced. They'll get there, there'll be say like a Black father there being super protective because he knows the setting and the risks that are associated, and is now labeled aggressive and has security called on him. We've seen that several times for the folks that we are sending to the hospital. And again, obviously that's racialized, but it's like kind of shows an interplay of like both fears that are rising, like very valid fears, and like very different racial implications that now are going to affect the care that the birthing person is going to get, even if it's not even directly related to them. We also see kind of related to what Paris was talking about, the idea that like, oh, this person like must be a drug user if they're Black, and folks actually not being asked for any level of consent, but now being tested for drug use. And then like the implications that come from that as well. But yeah, many examples of how racism shows up in healthcare people are receiving, but also in the ways that we can even deliver that care.
Y'all spitting. Y'all are spitting. We are only on the first question. Okay, let's get into it. I kind of touched on this here and there. Want to dig deeper into the topic of mandatory reporting. We know this is a big piece of the pie when discussing how the medical industrial complex harms birthing folks and Black people. Starting with Dr. Clare, can you speak a little bit about the ways that mandatory reporting shows up in your work, if at all?
Yeah, definitely. This one gets me and my co-residents worked up. ACS, which is our version of like Child Protective Services, like this one definitely comes into play with our work a lot. Well, I guess I would first kind of explain to folks who don't know what being a mandated reporter means. A mandated reporter is basically someone who is legally required to like report child abuse or instances of neglect to Child Protective Services upon reasonable suspicion. And as you can imagine, the idea of reasonable suspicion is like leveraged more against Black and brown and poor families than it is against white, wealthy families, especially in like similar circumstances. So yeah, and I think those dynamics are heightened even more in settings where a majority of the doctors are white, formally educated, bourgeois doctors, and then patients are low income Black and brown folks. Yeah, I think one thing is, or one of the many reasons why neglect comes about is because of poverty. Like when we talk about neglect or child abuse, we can't talk about that without thinking about poverty or the conditions that people are living in. And rather than offering solutions to poverty, um, organs of the state are basically telling doctors to be snitches, like just surveil, punish, and criminalize your patients and their families, threaten them with family separation instead of helping them in meaningful ways or offering them the resources they need to address kind of the reasons why they're facing or they're experiencing children are supposedly experiencing like neglect or abuse. Um, and yeah, I would say unfortunately a majority of my patients, my Black and brown patients, and families have either already been reported to ACS, like our Child Protective Services, have been threatened with a report, or are living in constant fear of being reported and potentially having their children taken away from them. Um, there's many like instances I can think of off the top of my head. For one, I have a family that I've been taking care of since I was an intern, so it's been about 3 years, and the mom disclosed to me she has 5 kids, she disclosed to me that she was in a domestic violence situation with her partner and was kind of fearing for her life, um, and she sought out care, like, within the healthcare system, and they reported her to ACS and had the children taken away from her, and she herself was uh, like, was put in the foster care system when she was a child, and she would always tell me that, like, her biggest fear is that happening to her own kids because she knew that going into foster care system was full of trauma and, was just such a negative experience and tore her entire family apart and, like, uprooted her entire life, so she never wanted that for her kids, and here it is happening to her and her kids because instead of offering this family help, someone, like, filed a report. And that's not the first time that that's happened with people who've experienced domestic violence trying to seek out care in the healthcare system and instead being reported and having their children taken away. And then I'm thinking of another instance my co-resident just told me about where a mother who's a recent immigrant from like Central America, um, she is making a living selling like candy on the subway and missed 1 or 2 appointments for her child, and someone reported her to Child Protective Services. And it's like, can we just think about some of the reasons she might have missed that appointment, especially if you are working as an undocumented person and like can't take time off work for an appointment because you're trying to make a living day to day. But instead of that consideration, it's just like the only tools at your disposal are to report a family. Um, so yeah, I imagine that in a more perfect healthcare system, instead of just seeing struggling parents and finding ways to like make them struggle more, punish them more, and put more of a burden on their lives, we instead see the ways that they're struggling and say, what are solutions we can do to address this? Like, is it that you need safe, housing? Do you need childcare? Do you just need money? Like, and that's honestly the answer for most people, but instead, like the only tool we have at our disposal is like report, file a report. Right?
Yeah, and Claire, like the things that you're saying. So it's so different to see kind of on that other side because I'm a OBGYN, so I deal with like the birthing person and parent. And my documentation can lead to so much criminalization. And when the baby is born, the investigation and everything kind of, when they're in the hospital, social work, everyone's kind of looking through things and whether or not, depending on how the patient was even acting. So that same patient, let's circle back, that I was saying that they were talking about was aggressive and irritable and combative, who was just asking to do something that she's well in her right to do. Um, and they said they were going to report her. So what's next? They looked through my notes, right? So I think that this is just something that is just really key, especially to any healthcare workers here, how you document things and how you're documenting that can possibly criminalize your patient is so, so important. Okay. There are certain things that you can talk about to your patients that don't necessarily have to be explicitly or how explicitly noted. Okay. Like my friends who are in psychology and psychiatry, they know this a lot, right? They can't, their patient's talking for 60 minutes. The whole interaction is about what they're saying. They go through, they say, the gist of things. They don't need to put specifically, like this one time this thing happened, right? Because people are going to be looking, people are going to be thinking that part out. And one of the books, I brought down these books that I wanted to show, and this is a really good book. It's called Torn Apart. I think we actually talked about this book, Leila, like 3 years ago or so. But it's called Torn Apart. It's by Dorothy Roberts, and it's how a child welfare system destroys Black families and how abolition can build a safer world. So I think that this is like a really important read for folks. Basically, providing more like concrete like data and like years of experience backing exactly what Claire was saying. They were talking about how Black subordination is hung on around patients as the thing like, do this or we'll take away your kid, right? And that has been going on since shadow slavery. Do this or you'll get torn apart from your family. Do this or you'll get criminalized. Right. And it's a whole thing about subordinating Black bodies and how the system itself is a racist system. She even says in it, like, if the system was so good, why are white people using it more? Right. like, so I think this was good. And she also had like a lot of kind of solution based things.
Yeah, I honestly don't have too much to add. Please read Torn Apart. I feel like she'll run circles around all of us. But yeah, nothing new to add.
Thank you for that. Right. Oh, go ahead.
I was saying, I'm sorry, my nails aren't built, but
Oh my God.
this is what we're here for.
And I don't want to hear no comments about the nails if you got a comment.
Yeah.
Okay. Sorry, just kidding. We're gonna keep going. Actually, Dr. Paris, I know you were just talking. Thank you for that lovely book recommendation. I want to talk to you a little bit about your experience with incarcerated birthing people in Florida. Can you speak to some of the experience, so your experiences there and like the intersection of incarceration and like repro health?
Yeah. So like I was saying, I lived in Florida for 4 years in Pinellas County, which has like a super racist history. If you look it up, it actually was in this Torn Apart book. Like, oh, dang, exactly where I was living. And we, as a residency, we saw a lot of incarcerated patients and provided prenatal care to them. So just kind of to go back, I love my stats. Like, even though stats are problematic about if you are specifically looking at like collecting the stats, but I do like stats to kind of put things into perspective. So 30% of incarcerated folks who are in women's prisons are Black, even though they make up 13% of the population, and about 3 to 10% of incarcerated people in general experience pregnancy, make some impregnant, they wind up pregnant throughout that. In specifically in incarcerated folks, there's a whole other level of justice and reproductive justice that can be said to kind of what they're going through. As far as prenatal care, the prenatal care, it's legally afforded by the state that you should have prenatal care for folks, right? But people are getting shackled. They're not getting proper medicines when they go back to their jail. Um, Basically, how the patients came to us, to our healthcare facility, they would be in jail. They would get in a van. They would cover up the van so they don't know where they're going because they don't want them to know what hospital they are. Because if they talk with someone, they escape. The patients aren't allowed to be told their gestational age. They're not allowed to be told their due date because if they know that, then they can be like, I'm around 40 weeks. Someone can meet me here at the hospital and help me escape, right, from my jail with these armed men, right? Also, certain prenatal cares that should be afforded to them or not. So let's say in a patient who has diabetes, the recommendation is for them to have what a high risk and to have something called the fetal echo, evaluation of the baby's heart, because the baby can have increased risk of not. They just don't get it. They don't get. They're like, there's not Medicaid's like, I'm not paying for it. They just don't get it, right? Which creates a huge issue during the actual birthing process, right? Because if you're birthing and then there's a baby that comes out and they need like cardiac help or resuscitation or something, and the proper peds folks aren't there, then that is what it is, right? There was like big push. Also, they didn't pay for genetic testing, which is just standard care. They're like, we're not paying for it. So we found ways around that by having companies that wanted us to use their genetic testing. You're like, we'll use your genetic testing if you pay for our all of our incarcerated folks. There also is a level of being shackled to the bed, being shackled on your seat, things like that. And I think that it was, me and one of my colleagues, Miriam, I don't know if you're out there, she actually did so much work in this area, but there was a huge push where I was like, oh, like, we're not dealing with this. No. So our residency and the residents, it was really good because we took a lot of like, we're going to read the laws, we're going to know our laws, we're going to stand up for our patient, right? So shackles, patients do not have, it's literally illegal if the physician deems necessary to shackle patient during the delivery process. They don't have to be shackled during postpartum and during exam. Guards, depending on the state, their guards can actually step out of the room, or if they're there, they can limit the amount of people in there, or they can like turn around. So when I went in there, I had this, when I was in my third year of residency, I had this security guard say, oh, I know who you are. Like, we have to sign in. I know who you are. You're Dr. McAllister. You're that doctor that makes the security guards turn around. And I'm like, I'm glad that my existence, like, me pursues you, right? Like, what I'm going to do. Yeah. Like, turn around, face the wall as I'm going inside of my patient and checking, right? Like, I'm literally doing something that's so sensitive. You don't have the right to look there. That's completely inappropriate. And it's not within your legal bounds, right? We had patients during COVID who needed a C-section. 3 armed guards were in the OR. And when I say we threw, I was like, absolutely not. Absolutely not. You think that your gun, y'all's training in your gun is more powerful than anesthesia, right? And absolutely not. This is like a health hazard, right? You're having firearms in place where they're responding to you, putting everybody at here. And we were like, get out. They called their supervisor, our attending time. They were like, get out. Like, one person can come here. They can stand at the door. You need to leave your guns. Like, get out, right? And so there's a level of kind of, and that situation where we're so kind of close and working in close bounds with guards and with cops, then you can say, like, as a healthcare provider, like, this is my territory, right? Like, there's certain things you can do to advocate for your patient. And my patients would love when I came in. I'm like, what's going on? Like, you're okay. And I'm like, hey, can you step out? Can you do that? And I'm like winking at them. I'm like, what do you need? You need me to write something? They still didn't give you your medicine. You need to sleep. You need socks. My prescription is socks, signed MD, right? Like, there's certain levels of advocacy that you can do within your like workplace, and even kind of going to there and going to the jails and providing care there, because they don't get appropriate care either. And kind of even after the birthing person gives birth, how the baby is taken away, right? So if they don't have certain support systems, or certain support systems the baby can get, and also this is Like I said, they don't know when they're getting, like, they can have a scheduled C-section. They don't know. They're like, I'm like, you're going to have a C-section. I'm not allowed to tell you when. You just all of a sudden get dropped off at the hospital with your C-section that day, right? So the person, once the baby's delivered, the baby's not going to go to jail. The baby stays in the pediatric custody until they decide who they're going to send the baby off to. So they also at those times give them options to be like, okay, there's no one that can take them, either foster care or an adoption agency is coming, right? An adoption agency is coming, and adoption is permanent. Like adoption, I'm signing away my rights. Okay. And this also intersections down real quick. I'll just tell this real quick. Ties on real quick to like unhoused folks. Same thing. If unhoused folks come in, they get birth, they don't have proper support system to let baby go. The adoption social worker, she'll say, but this patient, you can do CPS foster where you can figure out a place to live. We can do all of that. And in Florida, they didn't care. They were like, get out. Like, you don't have a place to live. You should have a C-section. Get out. Like, we're not providing you care in the place that is that. Like, we don't have any resources. You can call shelter that can take you. But as a person, if you give birth, and they're like, hey, there's an adoption agency that really wants your family, usually white, really, this is safe. And we'll give you a hotel. We'll give you food. We'll give you stuff. And we'll give it to you right? And like here. And then so they sign away because it's like either that or this, like, well, maybe you have a good life. And then all of a sudden, I can't even attempt or try or do things to even try to get this child. And that's the same way for like kind of criminalization of things with incarcerated folks.
I just want to add, I saw a question in the Q&A chat around, I think, Paris, they were asking you, like, how does, as an OB, like, how do you see healthcare showing up as like an imperial force? And I think you're describing it perfectly here, how like there are resources that can actually tear apart Black families. But those resources apparently aren't available when we're talking about supporting the family unit. And we see that same thing happen like both here in the States, but we also see that like on the continent and throughout the global South overall, where we magically come up with these resources for aid programs or for military aid in particular that destabilize entire countries. But when we're talking about like actual programming and systems that will empower the people on the land, then all of a sudden, like, we're hands off. And we see that replicated on like the micro level here in healthcare settings. I also wanted to highlight there's this organization that does like very legislative stuff, which I am not the legislative person, but it's called Restore Her, and it started by this person called Pamela Wynn here in Georgia, who went in, she was incarcerated at the time and started going into preterm labor. So she's having the pains. She starts like her amniotic sac ruptures. So now she's like leaking fluid and is unable to like actually get to the hospital. Guards don't believe her. There's like a huge lag time. And I think like literally like days, if not weeks, go by because she's preterm. So she is nowhere near close to her due date. And by the time she's actually able to see a healthcare provider, she has like there is no like living fetus anymore. So that of course was like a very traumatizing experience for her. And now started this organization, Restore Her, that does a bunch of work around like trying to fight like incarcerated folks going into prisons like and having to be shackled and trying to get them like more care while they're still like unfortunately like still incarcerated and in the jails and prisons. There's also like a lot of work happening around like Alabama and doulas. There's like the Alabama Prison Doula Project. There's also like some work happening in Georgia, like tied to Emory University's like I think nursing program, but like trying to expand actual like prenatal care and childbirth education classes to folks that are behind the walls. Like much more work to do, but like fighting these systems like head on is absolutely necessary.
Yeah, something that came to mind, Paris, when you were talking is it even feels to me that they're putting the child under arrest. Like you not being able to know your due date, you not knowing like, yeah, how far along you are, if you're going to have a C-section. And then afterwards, like the child is put in custody essentially until they find like a different caretaker for them. The child is also under arrest to some degree. And I like what you said about like when we're in the hospital or in the healthcare setting, that's our turf. Like the cops have no say, like they have no rights there. And I think we, as all the healthcare workers who are here watching tonight, I think you should also feel empowered to like just know that like this is your territory. Um, and it's not right for the cops to be listening in or watching while you're examining a patient or talking to them. Like that has nothing to do with them like being under arrest. So yeah, when you have incarcerated patients and cops are like standing around, tell them to leave. Like I do that all the time. I'll be like, "Can you, like, go walk down the hallway? Can you leave the room?" And I remember one time when I was in medical school, like, I'm, like, a third-year med student. It was on my OBGYN rotation. We had a patient who was, incarcerated, and me and my partner on the rotation, like, bought her Chick-fil-A. Like, we bought the lady Chick-fil-A, like, brought it, and the cops were so mad, and I was like, "What, she can't eat chicken? Like, why?" But, yeah, just feel empowered to know that, like, yeah, the cops really have no say within the healthcare space. You do, so you can, like, tell them off and make sure that also is a sign to your patients that you are in solidarity with them and not with the system that is, like, criminalizing or incarcerating them.
Okay, I was trying to make some spaces in case anybody else wanted to see. Um, yeah, yeah. Okay, let's keep going. I just want to take a breath. That is, yes, abolition now, first and foremost. Reproductive justice and abolition go together like birds of a feather. Okay. Um, let's talk about abortion a little bit. We're in the South. Well, most of us are in the South. Dr. Claire, you are up where everybody is going from the South to access abortion care. Abortion bans complicate care not just for abortion seekers, but for entire families, for medical professionals, and for communities. How have repressive abortion bans presented inside, complicated, and or impacted the work that you do? And then inside of that, I guess if there are lessons that you all have learned as medical professionals from abortion funds or like community organizers, as far as like how to work toward increasing abortion access, you can talk about that as well. We can start with Leila.
Cool. I just unmuted. Yeah. So it has completely changed the terrain and complicates the relationship of like the provider and the client or patient, whatever you call them. Like I get fear-based questions all the time because like we also like do GYN care for folks that are not pregnant. And when talking about like future like family planning and things like that, a lot of the times there's a lot of questions that come up around like, hey, me and my partner are scared. Like, what if I were to become pregnant and then I have XYZ complications? Like, what do these like abortion bans like mean for me and like my ability to actually like, choose to terminate a pregnancy? And I have heard multiple people make the decision that like they don't even want to open up that door just because of the amount of fear around like the unknown and like the fact that they no longer have autonomy over like their bodily decisions. Um, I also like shared with like the panelists like not too long ago about how like there was someone that I was seeing recently who came in for an appointment for a confirmation appointment and missed her period. And we talked about the fact that she was indeed pregnant and she had like a lot of complicated feelings around it. She also like had a young child at home, was like getting a lot of like negative comments from her family around being pregnant again. Um, and had not mentioned like any interest in termination of pregnancy during the appointment, but we later found out that we weren't able to like the front office like notifies me that like they haven't been able to get in touch with her around like scheduling future appointments. Um, I tried calling, other midwives have tried calling, the nurses tried calling, and we're no longer able to like get in touch with this person. After I think like there was like a referral for something was like what we were reaching out about initially. And that person like terminated care, I assume. And like we can only assume that like they were no longer able to like have that communication with their providers again because of fear. Like I can't tell you if I'm choosing like to terminate this pregnancy once I'm beyond 6 weeks, which is a lot of people don't even know that they're pregnant at the 6 week mark. Most people are finding out around like 8 weeks, by the way. But like folks are not like comfortable speaking to their providers around it because it's now been criminalized as if it wasn't already a difficult conversation to have with anyone. It's a difficult conversation to have with yourself for a lot of people. But to now have like this increased stigma around it and have it actually be criminalized means that they're actually at some points like doing like protecting me and like not sharing that information with me, which is something that you of course like don't want your patients to have to think about. But yeah, it has like completely changed the dynamic. And I think we have to like get creative around like different ways that we're having these conversations with folks and making sure that they know what resources are available. And again, being smart about charting. Charting what's absolutely necessary. So I can be sharing resources with you, but as far as like what's being charted, like I'm going to chart on the care that I provided. And I am not like, I do not provide abortion services. So therefore that is not in my charting. But there are other places that you can go. And I think like I want to connect with ARC a little bit more around that, like what it means for us to like share these resources and have that be like a seamless line moving forward. Oh, and then Paris, I don't know if you wanted to talk on this, but like even what that means for folks that are having complications. Because as a midwife, once there is any question around like the viability of a pregnancy, we're automatically referring out to like MFM, like maternal fetal medicine, things like that. But as a provider, like as the attending that we would be transferring to in certain instances, what is that experience like on the other end of having to like jump through the hoops of like proving the medical necessity for like a termination, things like that?
Yeah, exactly. That is one of the most difficult things. And it is a conversation, unfortunately, that I have had with so many patients where they come in and they're like, I'm pregnant. So first and foremost, I start off when a patient comes in for a first OB visit. I'm like, this is literally what I've learned to say. I just come in, I'm like, you're pregnant. And they're like, yeah. And I'm like, how do we feel? That's just what I say. I say, how do we feel? And they'll be like, sometimes they'll be like, oh, like, good, I'm happy. Like, it was unintended, but I'm happy. Or it'll get I mean, it is what it is, right? Like, it is what it is. There's nothing I can do. We're in Georgia. And that's when I'm like, actually, there is stuff that you can do, right? And that's when the knowledge and the healthcare worker knowledge, like, needs to come into play, like, needs to be, like, well-read, like, you need to know what you're doing. Like Leila was saying, these patients may not come back, because they understand, and there's very, like, the walls around this whole thing are very, like, iffy, like, it's so much space and room that people are like, "Hey, am I gonna get in trouble for this?" You were like, "I don't know, you may." So the whole thing of, like, aiding and abetting, like, it's technically not illegal anywhere in the United States to travel to get an abortion. They've been trying to make it. They've been trying to, like, different states have been really trying to pass it, especially Texas, Missouri, very much trying to pass things, but it's not. Currently, it's also not illegal for a provider to provide resources, but that is gray area, right? It could be, they don't know, you could be criminalized. And when you're criminalized as a provider, you can get your medical license taken away. You can face like felonies because you're aiding and abetting. Interesting. Adding a side note, aiding and abetting in actual genocide that is happening in Palestine gets you like more TV time. But that's neither here nor there. Actual. So as far as patients that come in who have severe complications, like I had patients who've come in who literally I had a patient who had like 2 or 3 different comorbidities, like hypertension. One patient, she got pregnant so many times. Her last 2 pregnancies, she had heart issues. They were like cardiac arrest, clots. They were like, if you get pregnant again, you can die. She got her tubes tied and she got pregnant. Okay. So she did everything she could, got her tubes tied, got pregnant. And she came in my office and was like, I guess I have to. I'm 12, 13 weeks. No, the hell you're not. I get my little packet, my little underground packet, my resource packet. The first things first in Georgia, the closest place, 12 weeks in North Carolina, right? So I am like, North Carolina, 12 weeks. New York, I refer everywhere to New York. I'm like, there's a straight shot. Like New York, y'all just be like, y'all be doing it. I think it's 22. Chicago also. So I'm like, these are the things. And then at the same time, they're like, well, I can't pay for this, right? And that's why ARC helps so much. And that's why a lot of providers don't know that it helps with like aiding And I feel like when, I don't know if it's still on here, or maybe someone else can kind of talk about that, because that's, I think, really, really important for people to understand those, because I have to now prove. And a lot of times when I was in Florida, it was 15 weeks. And then it was like, oh, if you prove that they need it out of medical necessity, then you can go ahead and we can do it. So we would have to have 2 high-risk doctors sign. They would look and they were like, well, I mean, is this really like, am I going to get in trouble if I put my name on this, right? I'm on the line. I'm the first person. So it would be like an inpatient consult. It was like, let's say a patient was literally like, we had patients who were like on dialysis or like something like that. And the fetus was looking like it had a term, something that was terminated, that it wouldn't make it past birth. And they were like, no, you still can't, right? So we would have to have 2 MFM consults, an Essex consult, so forth, so forth. In Georgia, that's not really a thing. Like, we don't actually, patients can be septic, having an infection in their body, be bleeding out if there is a heartbeat, right? Because the heart is not developed even at that time. And there's like a flicker, no, right? And so this is a perfect intro to my second Dorothy Roberts book, Killing the Black Body. Okay. Killing the Black Body. You know, the organizers, they've been reading that. Everyone, you got to read. Killing the Black Body. She goes in on it. And she had this amazing analogy during shadow slavery. She was talking about how there were instances where when an enslaved person is going to get beat, they would have to dig a hole and place themselves on their stomach so the hole can fit in their pregnant belly, so it would not get as injured as they were beating, right? So it's this whole thing of like beating and killing the Black body and the Black birthing person, and trying to protect the fetus, right? Even though they go hand in hand. So it makes absolutely no sense. And that has been going on for forever. And Black birthing folks, Black women, are the most likely to get abortion. That 60% of folks that get abortion care are folks of color, Indigenous folks, Black folks. There are higher instances. They are at decreased risk of having long-term birth control, and that does not mean that it's just decreased access, or just they're not seeking it out. Right? There's other things that if they're having side effects, people stopping them. If they like deliver, they have higher risk of preeclampsia, which can increase their risk of having blood pressure issues. So people just don't put them on there, even though they can put them on. So there's a lot of like systemic things, and there's knowledge-based things that healthcare providers need to know to provide proper care.
Okay. Always want to give space for the beautiful minds to turn those gears. Um, okay, yeah. I want to kind of wrap these 2 questions into one another. I feel like they're related. I also feel like y'all have been, each of you have been talking a little bit about how you, what resistance looked like in your neck of the woods, in your personal practices. So want to talk about that. So we know as RJ practitioners, medical professionals can often do the work of policing and further criminalization of Black, Indigenous, and poor communities, even if that's not their direct intent. We also know that Black August is not just about studying, but also about actively resisting. Something else that we know is that reproductive justice is not just about abortion access, but is about the ways that the capitalist state denies us of our fundamental human rights to health care and safe and sustainable communities. And each of you are not just medical professionals, but also community organizers who believe in solidarity. With all of these things that we know in mind, I'd love to hear you all speak about what solidarity means to you, how you put solidarity into practice, how you continue to resist inside of your practices, if you want to talk more about that specifically, and like what are other ways that people in your field could stand in solidarity with those in need. And feel free to like make connections to like Palestine, Cop City, all of the intersections.
Yeah, I have a lot of thoughts. I'll try to like keep them succinct. I think to the point of solidarity, first off, I'm Black. Like I'm a Black person living in America. I was raised by a single parent. I was raised by mother who's an immigrant. I'm first generation. We struggled to like make ends meet growing up. So I think I share a lot of lived experience with my patients and honestly, experience with the vast majority of people in the world who are just struggling to kind of stay alive. Um, and I also recognize that like the doctor label gives me just an extremely thin layer of protection, if anything. Um, but I'm still exposed to the same risks that my patients and other people who are Black, working class people are exposed to. Like, I also could be a victim of police brutality or police violence. I also could be a victim of white vigilante violence. But so and also, yeah, my right to an abortion is also hanging in the balance. I don't even really have good access to healthcare, even as a doctor. Like, I was just talking the other day about how I can barely afford my own copays for my own healthcare. Seriously. So, yeah, solidarity with my patients is realizing that our fate is intertwined, and there's no such thing as half freedom. Like, there's no such thing where half of Black people get to be safe and successful and out of harm's way while the other half are facing apartheid and genocide and war. That just doesn't exist. Like, as long as some people are suffering at the heel of oppression, my personal safety means nothing. It's not guaranteed. Um, so I think there's a lot of social conditioning within medicine from jump, like from when we're med students, when we're pre-meds, that separates us from the communities that we're serving and makes it like you're here, you're a doctor, you're a healthcare worker, your patients are over there. There's no overlap between you guys. Um, and I think that it's purposeful to so that we are not in solidarity with our patients. And I also think um like, I think we need to realize as healthcare workers that, we are exploited by the same system that is exploiting our patients. So, yeah, building solidarity means destroying a system of capitalism, a healthcare system predicated on profit, and building systems that are putting, the dignity and well-being of patients at the forefront. And, that could take on many different, like, I guess, forms. In this moment, I think it's very important for us to form like strong unions in our healthcare workspaces, to join political organizations as healthcare workers, to be involved in mutual aid organizing. And then also the specific skills that we have as healthcare workers is very important for the movement, for fighting for liberation and freedom. Just the other day with Healthcare Workers for Palestine, this was yesterday actually, we had a training on protest medicine and like street medic support. So at these Free Palestine protests where people are getting sprayed with chemical weapons and brutalized by the police, our role as healthcare workers is very important to provide care in those moments and like be at mass demonstrations where we can offer our health services to people and keep each other safe. But yeah, I think there's like many ways that we can be mitigating harm not only in the like healthcare space, but also like fighting for justice and liberation outside of work. And yeah, I think it's just a matter of like caring enough and like finding a role for ourselves as individuals.
Yeah, Claire said it beautifully. Yeah, I think the task is twofold. Like I think mitigating harm in the workplace as much as possible. And like killing the cop in your head. So like how can we like actually like minimize harm in each of these situations that come up and not just like follow protocol, which oftentimes is like a very like it just reinforces policing. So like actually like having to turn our brains on and like think through it differently and creating our own solutions there. But like the biggest thing for me, and I say this to everyone, regardless of what your job is, like there is a spot in the revolution for you, because I think that that is essentially everyone's role. Like I think as healthcare workers, you have a very like particular lens and like can view how capitalism like affects the human body in a very specific way and like hopefully use that knowledge to then start like world building like what different healthcare models could look like in the future. But if we do not end imperialism, like all of it is for naught. So like we are not going to have this perfect healthcare system, but like have imperialism and like capitalism like untouched. So like if we do not undo those systems both here at home and abroad, then we're just going to keep like fighting this same fight and going in circles. So again, just lifting up Claire already said, but like join an organization. Like we all need to be joining organizations that do work where we are. and do political education as well, so that we can like see the entire picture and see how everything fits together. And like can actually like join ranks with everyone on this call, people in other orgs, to actually like make that impact. Make that impact so that we have a world to win, and we have to, it's literally just us. So I think that we need to get out of like the little silos that we're in. And I'm excited to world build with y'all.
Yes, they basically hit the nail on the head. Just, you know, I specifically want to kind of focus on like Palestine and reproductive justice around Palestine, because Zionists right now, they're using the manipulation of reproductive justice as a political tactic, right? So 37 moms are killed a day. That's two pregnant folks an hour, or out, yeah, two birthing folks every hour. 60,000 birthing folks do not have access to prenatal care. So it's only, I think there's only 2 out of the 36 hospitals left in Gaza can provide maternal care. The preterm births are higher, the stillbirths are higher. I talked earlier about how, like, with Black struggles and Black increased um, morbidity and mortality, our society said, or American colleges such as and gynecology said, the reason is because of stress-induced racism. Like, imagine having a war outside, literally having things ripped from you. They're using all of that as political tactics, bombing people, bombing hospitals, bombing schools, um, and not even to say like, specifically using both what they say, like women and children, like look how bad they're being to them. Like Muhammad El Kurd, who, if you don't follow, you guys should. Muhammad El Kurd said is, they want to paint this perfect victim, right? But we're over here seeing like actual babies being burnt alive and like decapitated, and people are acting like that's not a thing, right? We want to talk about like, our level of being empty, like Claire said, like it's only going to protect you so much, right? You're going to talk about like being in a certain class, this like idea of like Black excellence and Black elitism. What's excellent and elite is being the doctors that are over there in Palestine operating while the whole hospital is being bombed. Like, that is excellent. That is right. And the fact that healthcare workers, I will say, have not been completely, not only outraged, but disgusted about what is going on, and as a whole unit, is just beyond me. And that's how you know it's something political, right? This society's American Medical Association and societies like that, things are happening in Ukraine, they post it everywhere. Things are happening about Palestine, they say Palestine and Israel, we hope you guys are good, right? These are just the ways that this language is taught. And I think that it's just really important to kind of, when you're going through this and doing the work, to do so with such a passion and such a conviction, which Joy James called Revolutionary Love. This is the 3rd book I have for you guys. I think my friend Steph got this for me for my birthday a few years ago. Hey, Steph. Does amazing work out in New York. Okay, this is another thing. And talking about revolutionary love, and basically saying like revolutionary love is not something that you're necessarily going to see the product of in your time. It's not necessarily going to just benefit you. It's going to exist beyond you. And Musa has a podcast that's amazing. It's called Groundings. It's great. You guys should definitely join it. It's one of the best podcasts. You want to learn about stuff. You want to feel like you're like really like understand organizing it, and then listen to that podcast. Okay. And their most recent podcast focused on the Jericho movement and political prisoners. And they said something in there saying that we need to institutionalize our movement, right? And our movement spaces, to go kind of beyond just like understanding and doing things, to really like push that movement into spaces that we can kind of have enacted into an institution that's going to live beyond us. So the whole, part of Black August, let's take it back to the beginning. We said study fast, trade fight, right? So those are, we've mentioned like amazing join an organization, read. But also within that podcast, Mrs. said something about like playing to your strength. It's important to play to your strength, right? So healthcare workers or physicians, like only just going out and doing direct action when you have 12 years of training and it's something that is needed is not enough. Okay. Being Black in these spaces is not going to, being Black alone is not going to liberate us. Okay. So really joining what like Claire said, like that is amazing. Like healthcare workers for Palestine, where you're actually, if you cannot, go over to Gaza, go over to other places and like actually, do the work. There's organizers who are doing the work, who are sacrificing their bodies or meetings on a daily, like especially making yourself really accessible for them. Like family medicine doctors, pediatrician, psychologists, like holding space, holding things for them, folks that are criminalized who get stuff that's happening to them. I know one of the people who was in Emory at the Emory protest in the campus who got literally trampled on. They went to urgent care and urgent care was criminalizing them, right? Like, yo, like you a doctor, you're a healthcare worker, you're a nurse, like figure out how to join into an organization, link it so that you can provide the best care that you can. And even if you're not inside the healthcare spaces, I encourage you, especially during this time of like understanding such revolutionary labs, to study that, train, understand what your skill set is. And even if you don't, like, you don't need to necessarily know, join an organization and they'll help you. Like, you don't have to reinvent the wheel. Like a lot of the work has been done for folks for decades. Yeah, and kind of one of the things I wanted to kind of close on is what Angela started with Asada support, and it will absolutely like I'm such a fan person of Asada support, but Asada support was amazing and was convicted of like allegedly like killing a cop, killing other people. So the irony in that, right? And was sent to a hospital, had like broken bones, was like shot. And in there, she takes account, like, how the doctors were looking at her, how some people would not, like, provide pain medicine, and, like, they were saying, "This is our turn." Like, unshackle her, give her pain medicine, do so and so. There's certain things that you can do. There's so much things you can do. There's, political prisoner souls who were in there incarcerated souls. The Jericho movement, once again, on the grounding podcast, talks about ways you can even let her write. Like, there's so many things and there's so many ways that we can be involved. Just doing it kind of based on that revolutionary love and not necessarily like needing anything specifically back for you. But yeah.
Okay. First of all, can we get some emojis? Can we get some emoji reactions? Can we get some claps in the chat for these lovely, amazing panelists? Y'all really were talking that talk, and I know y'all are also walking the walk. And I want to extend my personal appreciation for y'all because y'all are lovely, lovely, and this was fantastic. I learned so much today. Um, we're gonna hop into Q&A for a second. Hey, Musa, great to see you. Um, yeah, we're gonna get into the Q&A. Trying to look and see. Probably should just ask these in order, but y'all have talked about some of this. Let's see. Claire, can you elaborate on the links between family policing in the United States and the ways in which the United States policy, okay, and the ways in which the United States polices families abroad through the military-industrial complex?
Yeah, that's a big one. I wrote a couple notes to kind of like draw some connections. I think when we're thinking about US imperialism and war and kind of like policing abroad, I mean, that gets at kind of like structuring opportunities and limiting opportunities for people in the global South. And this could be through like structural adjustment programs that US foreign policy enforces, through blockades and sanctions, like we see in Cuba and Venezuela, where I think in Cuba, they said there's something like, I don't know the exact number, but something in the hundreds of people who are who need pacemakers literally for cardiac issues and do not have access to pacemakers because of US sanctions. Like, you're quite literally killing people because of US foreign policy. Um, and yeah, and not to talk of like war, like outright war and genocide, that again is like structuring opportunities and denying people access to like care and the ability to live their lives. So I think it's honestly just Dorothy Roberts, like Paris, I'm so glad that you talked about Dorothy Roberts because like she has formulated so much of my understanding about um like the carceral role of the healthcare system. And she talks about kind of like family policing and like the actual prison industrial complex and like the legal apparatus within the US as like a carceral web. And I think that carceral web also extends to US foreign policy and imperialism as well. And it's about kind of like social control basically. Um and yeah, I think again, that just gets at our need to like dismantling systems of oppression within the United States are also tied to dismantling war and imperialism abroad and the US's role as like a world dictator. And once we liberate ourselves, we're also like liberating other people like in other parts of the world. But
Thank you for that, Claire. And you mentioned Cuba, and I would like to remind people for 66 years now, there has been a U.S. total economic blockade on the island of Cuba. A really good friend of mine had a surgery last summer, and she had to bring the gloves for the operating doctor and nurses to wear during the surgery. So the level of depriving of resources in Cuba's medical system is directly related to the US government. And so these are things that we have to be able to call out, especially you all as medical professionals. So I really appreciate you for bringing that up. And I wanted to ask the next question, and this one will be for anyone on the panel who wants to hop in. The question is, how does the criminalization and policing of Black immigrants manifest in healthcare in your experience? What are some of the ways what are some ways the experiences of Black immigrants in the healthcare differ from Black folks born in the US?
I think one of the biggest things that comes to mind with me when I was in Florida, because the governor down there, DeSantis, literally every day just tries to write like a bill that's gonna or marginalize folks. And the the fear of getting healthcare, um, being in fear of being for specifically undocumented folks of being reported. And he actually was really trying to pass like legislation that doctors needed to call the law in case that happened. And I see that a lot where there was patients when I was in medical school, I was doing rotations in New York, and there was patients that flew, straight to New York to have their child born in US soil, and they would come in and have, no heartbeat, stillbirths, things like that. When we're trying to provide medical care, very this fear of oh, if I say too much, you're going to arrest me, you're going to harm me, you're going to tear me apart from my children and my family now. Um, and that's some of the things that, I definitely have seen.
Something that's coming up for me as definitely not a healthcare provider, but a person that exists in the world. Um, an issue that I imagine comes up with uh, immigrants in particular, black immigrants specifically, is like the language barrier there as well. People are like super xenophobic. Yeah, I remember the other day I was in like the line to get a check cash or something, get a money order, and the people in front of me were trying to send some money to somebody else, and the just the communication that was having to happen for them to like try and communicate. This is who I'm trying to get it to. They were the person behind the counter were just kind of like, all right, y'all have been here too long. Like, y'all are trying to scam. Clearly, like, just, you're gonna have to come back another day. We're not doing this. And I feel like those Yeah, those are probably dynamics that come up in our healthcare system as well.
100%. I actually wrote that down, Brittany, like language justice and just like access to healthcare providers who speak your language. I can't imagine how scary it is to be in a foreign country where you don't speak the language and be in a even more vulnerable position where you're needing to seek out healthcare and no one is speaking to you in your native language. So you have no clue what's going on. And in New York is allegedly the melting pot of the US. Like there's all kind of different cultures here, but even like simple Spanish, I'm like, why are doctors in New York not using a Spanish interpreter and just talking English to their patients and not telling them or giving them updates about what's happening? Or using broken Spanish and not explaining things in a way that that a patient can actually understand. So, yeah, I think, like, just simply, like, language access is a huge thing that is a further burden on an already vulnerable population of, like, Black immigrants and all immigrants in general, honestly. But, and something else that came to mind is I think this was in 2019, Stewart County Detention Center in Georgia. There was a case in which a lot of immigrant women, particularly like women from Haiti and parts of the Caribbean, were being forcibly sterilized in the immigrant detention center. And it became like big major news when there was a whistleblower, a Black woman nurse who whistleblowed and exposed the forced sterilization that was going on. But that's another aspect of it too. So, yeah, I think there's kind of a level of hyper exploitation when it comes to Black immigrants in particular, because you have the exploitation of being a Black, poor working class person, and on top of that, being undocumented or being an immigrant is even more of a way of being exploited.
I'll also quickly add that yes to language justice, but like when you have that experience of being a Black immigrant that now has these language barriers, but are still getting treated as a Black person in the US, that means that now your confusion in these interactions is now perceived as aggression or like being rude, etc. That just kind of ends up being a cascade of interventions from there. Um, and then you also have the fact that you're already interfacing with police at an increased rate again because you are a Black person. And now when your citizen status is shaky or like you are undocumented or whatever the situation is, you are more likely to be detained because you are getting pulled over more often. Have to deal with police more often as a Black person. So it's just a much more vulnerable position. So we do see that oftentimes it is going to be a lot of Haitian folks that are greatly impacted whenever we see anything around immigration past. Because again, they're Black folks that also happen to be immigrants and will get like the brunt of all of that. Um, I had a point and I forgot, but I'll shut up for now.
Appreciate you. This is our last question. I think this is the last question we have time for. Do you all have any tips for folks possibly in proximity to healthcare workers for telling them not to be cops? What do we do with this current reality of so many medical professionals being ops?
I type responded. My fault. I think I like sent a little message response to that one earlier. I didn't realize we were gonna have like a separate Q&A once the time was going by. But I would say like recommending some of the readings that like Paris pointed out. So Torn Apart, Killing the Black Body, like Medical Apartheid, like the list could go on. Just for folks to actually like be able to see themselves in the system and then realize the different ways that they can actually like minimize harm there. Because I don't know if it's just gonna be like there's no one size fits all. Hey, this is what you do in X situation.
Yeah, exactly. There's another book, I don't have it down here. It's by actually one of like our other comrades, Sean Harris. Um, and it's called Belly of the Beast. And they actually talk about like fat phobia, medical fat phobia, which is like that's like a whole other thing on rap about how it's rampant. But I think one of the and if you guys need like recommendations or anything like that, like you can comment under, I guess, Mark's thing, and we can drop some stuff from you if we don't have it in here, if you guys didn't get anything. Um, But I do want to say something really quick too. Musa put it in there, the chat about everyone, talking about Dr. Leila about that. I just want to dedicate, a space and time for her. She was one of my close friends. She's Palestinian. She was absolutely amazing in doing this work, provided so much passion kind of behind the Palestinian movement and the intersections for me as well. Her family is still going on and doing such amazing work in that space as well. So I definitely wanted to hold space for her because uh, she was studying to be a trauma surgeon to kind of go to Palestine and do the work. So just in her honor, that we have forgotten the words and things that you have taught us, and we just honor you in this space today.
All right. You all have been phenomenal panelists. We have had phenomenal engagement from our chat and phenomenal questions. I really appreciated so much of this conversation from start to finish. I was over here just snapping and clapping like I'm in a church choir. I got a Muslim in the church choir over here. And I want to thank you again, Paris, for uplifting Dr. Rukaya. She was a close friend of mine as well, and she was literally clocking in to do surgeries and continue helping patients even in the last few months of her life. And so she really set the bar high for all of us. And I'm going to stop talking about her because I'm getting a little emotional, but thank you for that. And so as we continue and go on throughout the last week or so of Black August, I want to invite everyone to once again remember Black August is dedicated to studying, training, fasting, and fighting. And so take those 4 principles and apply them to your life within your own capacity as you are able. One of the ways that you can help support conversations like this, support your local abortion fund, is actually to make a donation to ARC Southeast. You can make a one-time donation or become a monthly supporter. And I actually am going to drop that in the chat right now in case anyone, this is like the equivalent of passing around the digital offering tray. I don't know why the church analogies are coming up so much today, but slash. So it is tinyurl.com/RJ donate. And I want to thank you, Brittany, for facilitating this wonderful discussion. I want to thank you, Leila, for bringing in this important midwife perspective. Claire, for discussing your solidarity work, family policing, and family medicine. And then Paris, as the OB in the room, of course, holding it down for all of us. And with the statistics, Paris came prepared with the statistics. And we love that. So again, y'all, I invite you all to check out ARC Southeast on social media. That's at ARC_Southeast on Instagram. And then again, you can donate at tinyurl.com/RJ donate. Abortion funds are holding down entire communities. We are speaking with callers every single week and trying to make reproductive justice a reality across the Southeast. And so with that, I want to say thank you, and we will be closing out the webinar now. We'll also be sending up a follow-up email to everyone who attended with some of the links, the books, and all the different things that the panelists talked about. That way you can tap in. They all mentioned organizing and organizations, so y'all can find one and tap in and get organized. And peace.
Thank you, guys.
Yeah,
Thank you.
Thank you so much, Musa and Brittany, for putting this together.
Yes, really, really appreciate you guys. I wonder if it does like it'll pop up as an emoji on here. It's not like, no, this is the Gen Z thing, right, guys? It's fun. It's a little different. It's not this anymore. That's just too old. You have to be like,
Yeah, mine keeps doing the hearts, if you notice. It's look.
Yours don't.
Oh,
All right, I'm about to end the webinar. Bye, y'all.
Hey.
Bye.